Like most people, I have a concern over our environment, and healthcare represents quite a big chunk of the carbon we produce in the country.
Your average operation uses about as much carbon as a car journey for 500 miles. That's a lot. It's avoidable. Let's try and find solutions.
There's been a number of surveys over the years of NHS staff, and they consistently show well over 90% of people, often 95, 96% of people in the NHS really care about climate change and really care about what the health system should do.
So what we really wanted to do is to try to start off with one of the areas of healthcare which is a high carbon user, which is surgery. So we were very interested to fund a report that took lots of stakeholders, got lots of ideas for how solutions could be implemented, what to do, and to create a roadmap for the future.
So when we think about the provision of surgery, the key contributors of greenhouse gas emissions are our anaesthetic gases as well as our energy use, mainly for the maintenance of our theatres, our heating, ventilation and air conditioning, and we have a huge over-reliance on single-use items. So the report very much focuses on how we might mitigate the environmental impact across those three areas within the operating theatre. But we also recognise that there are significant emissions associated with the whole surgical patient pathway, and so the scope of this report extends right upstream to look at whole patient pathways and how we might be able to streamline the outpatient appointments all the way through to final discharge. And we go beyond that to also look at the role of disease prevention and health promotion and how that might assist us in transitioning to sustainable models of surgical care.
And the most important thing is it describes action that everybody can take, whether you're a patient, whether you're a surgeon, whether you're a policymaker, whether you're a supplier. There is something in here for you.
If you download this report, it's going to give you some solutions to how you can make a difference, how you can work with other people to start tackling that massive problem.
What we do between now and 2030 is of utmost importance, and we cannot wait for systems to change. We need to all be taking action tomorrow and thinking about that one thing that we can commit to.
I think what we're talking about is it's a win-win. Being green is actually making better systems, making it better for patients. It's about building resilience in our supply chains and saving money. So although change is always difficult, how can we afford not to invest in that?